Welcome to the Chiefs. Ako po si Roby Alampay. Kasama po natin online, Ami Pamintuan of the Philippine Star. Ami, good evening.
Good evening.
So kanina nailibing na si former President Fidel V. Ramos. Ano bang eksena doon?
Well, ang kakaiba nga daw doon ay yung presidente mismo nagbigay ng folded flag to the widow, si First Lady Ming Ramos.
Pero hindi siya nagsalita. Ano? There was no speech from President Bongbong Marcos.
But si Mrs. Ramos ang nagsalita at siyempre nagpasalamat.
We haven't seen Ma'am Ming in a long time.
Yes. Oo nga.
And ano pang mga balita? No? What headlines are you preparing for tomorrow?
Hindi naman headline, pero pinag-uusapan dito dahil malapit kami dito. Mayat maya nagbabaha and the floods are terrible. Mabuti wala today. At nililink nila yung ewan ko, pinag-uusapan kung totoo, nililink nila yung Dolomite Beach sa malalang baha dito sa part na to ng Manila. At sinabi ng MMDA or DPWH talaga daw hindi nagfull blast yung pag-function ng mga water pumps dahil kailangan ihis yung tubig na madumi from the Dolomite Beach. So titignan natin kung ano yung development dyan.
Pero two things yun, di ba? I know it has something to do with the pumping stations, unfinished projects to that end. Pero yung Dolomite Beach, was it a cause or dadaanan lang yun dapat ng pagdaloy ng tubig?
Hindi nga daw dapat padaanin doon yung maduming tubig. Kaya inaayos pa yata yung pipe, yung water, yung daanan ng tubig. So hindi pa tapos. So hindi natin alam kung directly yun ang cause ng malalalang baha ngayon. Although sabi nila talagang unusually heavy daw yung rainfall the past few days.
In any case, certainly susundan po yan yung unfinished projects na anti-flooding causing those problems in Manila. In the meantime, let's talk about another crisis that we started with, an education crisis. We bring in our first guest for the evening, Policy and Advocacy Manager for the Philippine Business for Education, PBED, Marco de los Reyes. Good evening. Welcome to the program, Mr. de los Reyes.
Good evening.
Good evening, Roby. Good evening, Anne.
Sir, nabanggit natin, 91% unable to read by the age of 10. That's just one of the symptoms to what people are calling an education crisis. But let's get one thing out of the way before we get this conversation going. COVID. Do we even need to talk about the lockdown as a factor here, or even without the lockdown, we will be in this crisis?
Yeah, no. Actually, Robbie, even before the pandemic and the lockdowns and the closures of the schools, way back in 2020, before that, we are already in the learning crisis. We've seen that in the international large-scale assessments, PISA 2018, CPLM, and the TIMSS. When we combine these three international assessments, we see that around 70 to 81% of our learners are below minimum proficiency levels in reading, science, and mathematics. So what we see right now, based on the World Bank, the updated World Bank report of 91%, the pandemic and how we responded to it merely exacerbated the existing learning crisis that we already have.
Marco, I'll just take note of your language because sabi mo, learning crisis. We called it an education crisis. Is there a reason why you're not calling it an education crisis, and what's the difference?
That's very sure of you, Robin. And I believe it also, when we use the term learning crisis, it hits to the core of what we want our learners to do and to happen in the education system, and that is to learn. And if our learners, our students are not learning, as we see now in the large-scale data, then we must call it as it is. It is a learning crisis. And its impact is not just about them not being able to read, to count, etc. There's a subtlety here. For example, in PISA 2018, aside from assessing the performance of our learners, if they're able to read, there is also a question about growth mindset. And here is where I'd like to piece together from the learning into the mindset of our students. Why? It said in the PISA 2018 that around 70% of our learners think that they are born with the intelligence that they already have, and it cannot change. So imagine if our learners are not able to read, right? And it talagang na-ingrain sa kanilang pag-iisip na parang hanggang dito na lang ako. And nakakalungkot yun. That's why it is how we call it as it is. It is a learning crisis, and we are always looking for ways and means to solve this learning crisis.
So it's a crisis, we have learning poverty, at sabi nila because of COVID, lumawak daw yung learning gap, especially between the haves and have-nots, ano? The private schools mostly, the exclusive, and yung mga naiwan doon sa, especially in the remote areas serviced by the public system. So merong private school initiative for learning recovery, no, post-pandemic. Can you tell us more about that and compare it with, because the Department of Education launched its own learning recovery program. Can you tell us more about it?
The learning recovery program takes place, number one, by assessing the level of learning gap that the student has had in the time of the pandemic. So we had this project, for example, we launched this in Cebu. We did we had 1,000 learners from grades 1 to grade 3. And we assessed them. May baseline kami. Ano yung kanilang natutunan when they were during the pandemic? So that was our baseline. And then we gave them the intervention. The intervention was we gave them a mobile application with a tablet, and then they have their individualized tutors. And based on this 3-month intervention, we did our post-test. And we found out that the learners were able to catch up on that learning gap, right? So we did it by literacy and numeracy. So that learning gap, we were able to bridge that and to close that gap. So I believe that these kinds of models of learning recovery should be done also in other places, by the schools. I'm pretty sure that is the mandate given by our Department of Education. And this is a model that the PBED has been sharing with the Department of Education, with other schools, that we have tools available for us. Most especially, it has to be guided and individualized to understand that the teacher can now understand na ito yung learning gap ng aking student. Dito ako magpo-focus para makakatch up siya.
Would you have an idea how much is the learning gap? How wide is the learning gap in the public school system during the pandemic lang?
Well, I don't have the exact numbers or data, but based on what I've heard and monitored in the social media, based on anecdotal evidence coming from teachers themselves during the pilot run of the face-to-face classes, so they reported that their students were really not able to read, they were not able to have that attention span. So I would, again, this is just an educated guess, but say for example, baka ang learning gap dito is equivalent to around like half of a school year, half of an academic year.
Yeah.
But what I'd like to add, based on that hypothesis, is that we can do some things to make that jump, to bridge that gap, which I mentioned earlier, yung model that once the teacher understands the individual learning gaps, then the interventions can now take place. And we are glad that magkakaroon na tayo ng face-to-face class. I see some private schools are already, their students are going back to classes, and students are really excited about this. And yeah, I feel like we just have to channel that kind of energy moving towards August 22 when the public school system goes back to school and their classes.
Let's assume everything falls into place and everything is there by the time things normalize in schools and for our students. Pero gaya nga ng sabi nyo, even before COVID, we were already in this crisis. how do you even outline, the 3, 4, 5, I don't know how many, but what are the main headers in your outline of where the gaps are that are easily identifiable and therefore gives us a plan of attack?
Right. So if I may outline first the short-term strategies to address this learning gap, as I particularly mentioned, no? Do that assessment, number one, assess, and number two, classroom level intervention to close that gap. So those are the short-term solutions. Of course, you must also add that we must minimize disruptions in classroom instruction, disruptions in school time, and we know that that this season right now, kapasok na yung mga typhoon. So we have to minimize those kinds of disruptions in the classroom time of our students. So those are the short-term solutions that we feel that our public education system and other education institutions are already aware of. Now, if we go to the long-term strategies that we can do, we in PBED believe that we should focus on the early grades. Let's start them young, number one, as young as even before they go to kindergarten, right? Because pre-kindergarten, if we do properly our early childhood care and development, our ECCD programs, it is a great equalizer. It provides equity to our learners, even if they don't have that access to learning and development at home. But if they have that access to public ECCD programs, then once they go to kinder and then they go to grade 1, most likely they should be able to read na. So yung solution natin for the non-readers on age 10, we can practically do it on the early grade. So this is something that we can map out in the long run. So this is a clear strategy for us so that in the coming years, we are able to see our learners to become not just readers, but proficient readers. And proficiency, it will channel through their proficiency in reading, in science, and mathematics. We see the association between them not understanding the text that they are reading in the exam and not answering properly in the science and mathematics. In PISA, practically yung 81% na non-readers, ganun din yung naging score natin sa science and mathematics. 81% din yung low performers natin doon. So it channels through. We have to build a population, our generation of readers.
How many years are you proposing yung pre-kindergarten na yan? Kasi, of course, ang problema dyan yung pera, no? Kailan lang ginawang mandatory yung kindergarten, free, universal kindergarten. How many years? Kasi, pag yung mga may pera, siguro mga 3 years old pa lang yung bata, nandun na sa kiddie school
Right.
What's yung 1 year before kinder, okay ba yun?
That's a good point, Ami. And I'd reply by first starting with kindergarten that we already have a law. It's really a matter of implementation and our children going to school in the kindergarten. Now, even the pre-kindergarten, in fact, we have our early years act. And this is a mandate of local government units, right? This is a mandate of local government units with the technical support of the Department of Social Welfare and Development. So there are actually standards for us to follow in terms of pre-primary. Again, this is, I would like to share these thoughts to our viewers that this is something that is already a matter of policy that has to be implemented. Yung pre-kindergarten child development ng ating mga kabataan. Yung mga LGU po natin, ang dapat pong nangangasiwa, yung mga child development centers natin, yung mga supervised na neighborhood place natin, para yung ating mga anak, yung ating mga kabataan, kahit na yun nga, wala silang pera para sa private nursery or pre-primary, ay dapat available ito sa ating mga komunidad.
Can you cite which LGUs have that na yung pre-kindergarten?
Nakita ko po yung meron tayo sa mga sa Pasig, nakita ko po yan meron even sa Davao, may mga ina-awardan naman po tayo. Pero yun nga I haven't seen a national stock taking of the number of pre-primary or child development centers and how functional they are. I think that's one area I'd like to see, and I hope our government agencies, our legislators can stock take on this aspect, because it really matters. Evidence shows that even a 1-year addition to pre-primary learning goes a long way, as it has been shown in the PISA results.
Ni Mr. De Los Reyes, nung inaugural, nung SONA, sabi ni President Marcos as to the sorry state of the materials that we use to teach our children. Sabi niya nga, and I'm not talking about history, sabi niya, yung ginagamit natin na resources for science, technology, mathematics. And I think we all know what he was referring to. Nagba-viral yan tuwing meron tayong nakikitang materials na, ano naman, saan ang gagaling to? Bakit ito ang tinuturo sa mga anak natin? And he said, President Marcos said, this must end. Ano nga ba punot dulo nito? Because in fairness, we have been seeing example of these terrible materials for decades, in fact, for generations. Ano bang punot dulo niyan? If we are going to end the horror stories about the materials being used in our schools, where do we end it?
There's a lot to unpack on that question, and maybe I would start with the observation that a lot has improved actually in terms of materials, of textbooks in our education system. But there's still a long way to go in terms of getting it up to standards. And I wouldn't even say international standards, but even standards na lang natin na publiko, na standards natin na citizens or netizens. Ano ang punot dulo o paano natin solusyonan? I hear that it says it's about quality assurance. And the way I see it is that I believe the Department of Education Central Office cannot do it by itself. It's just so big. There's just so many materials to do it. So the quality assurance standards should be cascaded down to our school division offices, etc. Now, once that is there, it's cascaded, the standards, then there has to be an accountability. Who is accountable in assuring that the quality are at par at the national level, so the accountability at the local level. So these are parts of the system that we want to see and understand, so that the quality of our instructional materials will be provided for. I believe, it's really easy to hear and it sticks. Pag nakarinig tayo ng horror stories, I'm using the President's words here, the horror stories. It sticks to the mind. But I still believe that, by and large, our instructional materials have improved through the years.
Yeah, and that's fair. But is it just a matter of being overwhelmed? Is it just a matter of being understaffed? I mean, you talk about quality assurance and accountability. Maybe just paint a quick picture for us. How does it work here? How do you do quality control here in the Philippines, both at the national as well as regional to local levels? And for that matter, baka may alam ka, how do they do it in other countries? What are the best practices for quality control? Hindi lang naman tayong malaking bansa.
Right. So what we see in other countries is that they have like national standards in terms of textbooks and materials. And based on on that kind of national standard, then it will be cascaded down into their school districts. And I guess that's the same model that we aspire to have right? But for example, when we had the pandemic, parang medyo mabilisan talaga na pinabayaan yung ating mga, sorry, I shouldn't have used that word, but it was mandated to our school divisions to produce the modules. So that aspiration and the practice was not met. But I believe that we are actually doing the same model in terms of quality standards in terms of textbooks.
Ihabol ko lang still on the inaugural speech and the SONA, President Marcos has reignited this debate on the medium of instruction. Do you have any position on that, your group? English ba o mother tongue ba or Filipino, Taglish, ano ba?
Yes. And PBED supports the implementation of the mother tongue-based multilingual education. It's supported by evidence that our learners understand more quickly, acquire proficiency in their first language or their mother language, or more easily the language that they use at home. So once our learners are using the language they use at home as a medium of instruction in their classrooms, they acquire the proficiency levels required for that first language. So yung reading, yung writing, and so on, nagagawa na nila yun sa ano. That is the ideal. Nagagawa nila yun sa mother tongue nila. And then the acquisition of the second language after grade 3, kasi hanggang grade 3 yung MPB, MLE. So after grade 3, the ideal scenario is that they are well versed and proficient enough in their first language. So when they transition to the second language, English, Filipino, mas mabilis yung kanilang acquisition ng reading, writing proficiency levels in the second language. So that is the ideals, that is the model, and that is also part of the international evidence supporting mother tongue-based multilingual education.
Okay, Mr. De Los Reyes, one last question na lang. You are, of course, Policy Advocacy Manager for the Philippine Business for Education, or PBED. Anong role na dapat gampanan ng private sector dito? I mean, anong handang gawin? Anong dapat hamon din sa ating private sector when it comes to helping fill the gaps in our education system?
Right, Robbie. So I'll start with number one, that the business sector, the private sector, really proposes that we have to focus on education reforms as our strategy for national development. And we've seen that in other countries, that countries who improve their human capital have sustained growth in terms of their economic development. Second, provision of, or the private sector helps support the provision of the other needs of our learners. And this is the model of what we call like the other needs of the students. So like the public sector provides for the learning in the classroom, while the private sector, as we have seen during the pandemic, supported for the other out-of-school needs of the learner, coming, for example, the interconnectivity, the gadgets, and so on. So this is a synergy that we see together with the public sector and the private sector and our civil society organization. This is a synergy that we want to replicate in other communities, so that at the center are our learners. At the center, our learners are supported by these different stakeholders.
Okay. Sorry, sinabi ko, last question, may naalala ko, nabanggit mo kasi yung gadgets. Ito mga Intel Celeron computers na sinupply. I won't ask you what happened. Of course, this is something that has to be investigated. But I guess my question is, how does something like this happen?
Well, I really find it hard to believe and understand how these kinds of things happen. From what I understand in terms of government procurement, is that there is a person ultimately accountable, right? It's the head of what they call this, head of procuring entity, something like that. And along the way, along this system, something went amiss. The accountability channels and levels were not followed. I saw the COA report itself, and binasa ko eh. The PSDBM requested for like quotations, and then they practically just copied one of the quotation from one supplier. So there, I think that's one area that I see that the accountability system was cut off. I hope that these kinds of events can be answered quickly, because we don't want these kinds of noise that will affect the provision of inputs, the provision of reforms for our education system.
Okay. Mr. Marco de los Reyes of PBED, that's the Philippine Business for Education. Sir, maraming salamat po.
Thank
Salamat din,
you.
Roby. Thank you, Ma'am.
And we'll start up another conversation after the break. Keep it here on One News. Okta researchers say they're quite concerned the latest COVID wave is taking longer than they had expected. Will cases peak in time for the Burr months, right in time for Philippine holidays? Let's ask the Health Department's Officer-in-charge. Welcome back to the Chiefs, Undersecretary Maria Rosario Vergeire.
Good evening, Usec.
Magandang gabi po sa inyong lahat. Good evening po.
Ma'am, kamustahin lang po natin. Kamustahin natin yung COVID situation. And of course, it's not just the holidays we're concerned about. The numbers are also rising and high. Just as we're talking about face-to-face classes, ano pong nakikita natin in the coming scenarios?
Well, we are seeing that the cases are continuously increasing. There are 2 regions already in the country with a moderate risk case classification. That would be NCR and CAR. We also have increasing admissions among our hospitals, although most of this would still be mild, asymptomatic, and moderate. We also are seeing an increase in severe and critical cases, but this is just very minimal. Still, the number of severe and critical cases among the admissions would be less than 10%. Currently, it is at around 8.8%. The number of severe and critical infections right now in the country would total around 860 plus. And this would be a little bit higher than the previous week, around 50 to 60 cases higher. So what we are seeing right now would be increase in the number of cases continuously. We have these updated projections coming from our autumn model, wherein it states that if this booster uptake continuously to be slow, and also if minimum public health standards would still have this reduction in compliance, and of course, the entry of these different subvariants which are highly transmissible, we would still see cases increasing and peak by October of this year. So we would have around 10,600 cases in NCR alone by October, if and when these projections will happen because of these assumptions that we have just stated.
Pero yung isang key assumption nga po doon is if the uptakes for booster remains low. May modeling po ba tayo to illustrate, to our public as well, that if they start taking boosters, how much easier, or not necessarily easy, but what does this do for our ability to arrest this rise in numbers?
Well, first, we also have these projections made by the autumn model also, our experts there, that if this continuous slow uptake of boosters will continue, we will also have increase in the number of hospital admissions by October. So simply stated, if we receive our boosters now and we get this immunity up, these projections that we are talking about will not happen.
Yung case infections nyo, yung records nyo, how accurate might that be? Kasi ang dami kong kilala, ma'am, na mga na-infect and they have been vaccinated and boosted. Pero first time nila na-infect and nearly all of them na-testing antigen. At dahil symptomatic sila, they don't get RT-PCR na and it's not reported I think it's pretty common, ano? So, gaano ka-accurate kaya yung mga figures natin?
Yes, ma'am. So, based on our protocol, if you are symptomatic and you are tested with the antigen kit, it's going to be when you're positive and then that is confirmed positive already. Yes, we do not report it to the public because up until now, we still have incomplete reports coming from our local governments and other implementing units for this, especially those who are doing this at home. That's why we still cannot include that as part of our public information. What we have right now as public information would be the consolidated counts for our RT-PCR test. And based from our estimates, because we still have this data collated coming from those who are submitting for antigen, it's about 25% of what we have right now, wherein it's turning positive. So pag tinignan ho natin, we really had been informing the public that what we have right now as numbers are still not complete because antigen tests are not there.
In any case po, ang assumption naman talaga natin, mas mataas naman talaga. I think everybody understands that the other side of that is something that you have also always tried to emphasize when we talk about the risk level. We're also looking at hospital utilization rate. You've already touched on some numbers there, but give us the bottom line, the bottom line picture here na tumataas ang admissions.
We are hitting around 70% of utilization of beds for non-COVID right now among the different hospitals in the country. So this gives us additional burden to the already existing burden of COVID-19 admissions. So if you see right now, what we are having for COVID-19 is quite manageable. When we tried analyzing our data for COVID-19 admissions, most of this would still be mild and asymptomatic. Around 55% are mild and asymptomatic, 34% for moderate, and the rest would be less than 10% for the severe and critical. What we are trying to navigate our patients right now, because really for the non-COVID admissions, it's really increasing.
Ang inaalala ngayon, Usec ng mga tao is the school opening, start of, hindi pa naman full face-to-face, but marami-rami na yung schools na mag-uumpisa na rin. Sabi naman ng Department of Education, saka yung higher education institutions, they are implementing measures. Pero kayo, what do you want to see in the school system by way of protecting children, learners, and educators alike from infection?
Yes, ma'am. Of course, what we really want to see would be that parents would be more encouraged to have their children vaccinated. That's number one. But we don't mandate it. It's not part. It's really voluntary at this point. So we are going to set up these vaccination sites through our local government so that it will be more accessible. We also want to see that there is adequate ventilation in each of the classrooms that children will go into, and that there would be safety officers to be monitoring and enforcing our safety protocols, and that all schools in the country would have this referral network, that anytime that a student will be identified to have symptoms, they will be immediately referred to this facility that can be able to manage the patient.
Merong proposal si Dr. Ana Ongim, sabi niya, kung half day lang naman daw yung classes, maybe the policy of giving children recess to eat. Pwede naman mag-recess para lang magpahinga, but to eat daw and take off their masks, baka daw pwedeng i-review. You think that's a good idea?
Well, if we are going to have a well-ventilated room for that, of course, we will agree to that because the children would also really need this kind of breaks from their school work. What we are also proposing together with sila Dr. Ana, our tag experts, would be there would be this scheduled time that children will go to the canteen, no? Para hindi po nagka-crowd. Usually kapag break time, sabay-sabay yan eh. But if we can have scheduled time so that children can have more space and it's not going to be crowded in canteens, that would be ideal.
Ma'am, kumustahin lang po natin that first case of monkeypox dito sa Philippines. Ano pong update natin?
Yes, sir. Ito pong ating first and only case of monkeypox right now in the country has already been discharged from isolation. Siya po ay nag-home isolate after his confinement in our hospital, and all of his symptoms have resolved already. His lesions have healed already. He had 10 close contacts kung saan they are continuing quarantine, and nobody naman has experienced or has shown any symptoms at all.
What does that mean for our protocols? What does that mean for our level of concern for monkeypox here in the country?
Well, we should still continue to be vigilant. No, it doesn't mean that because meron lang tayong isang kaso tapos gumaling na siya, and even if the close contacts wala ring simptomas, ay hindi na pwedeng mangyari sa atin ito. Kailangan tuloy-tuloy pa rin po tayo that we will be aware and we will know how this is transmitted and how to protect ourselves. So wag po tayong complacent. We still are doing this intensive surveillance across the different units of our country and even in the borders so that we can prevent further transmission.
Pareho lang yung protocols for COVID and monkeypox, or medyo may konting pagkakaiba? Kasi sabi nila, pag nadikit ka daw kahit sa clothing with yung infected clothing, you can also get it.
Yes, ma'am. No? So the basic difference really would be the mode of transmission. Ang ating COVID-19, it can be inhaled, no, or transmitted through air. May droplet infection. When you are in a closed setting, pwede rin maging airborne. Pero ito pong monkeypox, close contact po talaga, direct contact. So even if you just go with him, a crowded place, tas nagkadikit kayo dun sa inyong mga katawan at may lesion siya, you can get it. But there are also other modes of transmission for monkeypox, like the secretion of individuals. So halimbawa po, nag-kiss sila, yung saliva, pwede rin po magkaroon ng transmission dyan sa sakit na yan. And even through sexual contact, they can also get that. And as you have said, through the clothing, no, yung mga hinubad na damit, at nahawakan natin o nadikit tayo, ito po ay maaari rin makapag-transmit ng infeksyon.
Okay,
Are we procuring, kasi konting-konti pa daw yung supply ng vaccines being used not for monkeypox actually, but I think it's working for monkeypox, ano? Ang konti-konti daw ng supply. Are we making an effort to procure o bahala na pag dumating na lang dito?
Hindi po, no? So we are being proactive on this, no? Actually, since May po, nung nag-umpisa po itong mga kasos globally, we started exploring avenues already kung paano. So right now, we have already identified 3 manufacturers of monkeypox vaccines at tinitignan natin kung paano po na makapag-apply na sila dito sa Pilipinas. Pangalawa, meron na rin po tayong initial na request from our bilateral relationships, no, with other government, kung saan tayo po ay nag-explore kung maaring madonitan tayo kahit kaunti. But one thing I'd like to inform our people, that the vaccines for monkeypox would be different from the COVID-19 vaccines. Hindi po sa lahat ng tao ibinibigay ang bakuna ng monkeypox. Doon lamang po dun sa high-risk sector natin, katulad po ng ating mga healthcare workers, because they will care for these individuals who will have monkeypox. And also those sectors na identified natin na talagang vulnerable sa sakit na to.
Sige. Speaking of vaccines, balik po tayo sa COVID. Specifically, yung concern pa rin natin about boosters. Alam natin na mabagal pa rin ang uptake for boosters. But what do we understand at this point about why mabagal ang uptake sa boosters?
Well, we conducted a survey, no, because we are really kind of questioning bakit kaya ang mga tao last year, the interest was really high. what happened now that they wouldn't want to receive their booster shots. So we had this survey kung saan lumabas po sa resulta, no, the primary result would be that they are already confident with their first 2 doses. And sabi nila, nagkasakit na rin ako during the Omicron situation natin on January to March, and nakita nila walang masyadong severe and critical. So they are already confident, no, with the first 2 doses. Another one would be yung result na sinasabi nila na they don't need it because hindi naman yan kinakailangan pag pumasok ako ngayon sa trabaho, o di kaya pumasok ako sa eskwelahan, o di kaya ay pumunta ako sa public spaces, because our definition for fully vaccinated would still be the first 2 doses. So ito pong dalawang tong ina-address natin ngayon, and hopefully, no, we'll get a go-ahead, no, with these policies that we are recommending.
To that point, ma'am, just to be clear, we're rethinking the policy of how to define fully vaccinated.
Yes, sir. So we are recommending this, and hopefully we can get an approval. But of course, this would take some preparation for the community also, and of course, the other sectors. Dahil alam naman natin na magkakaroon din po ng epekto ito sa ibang sektor natin, kaya pinag-uusapan po maigi ito.
Ano yung resistance sa proposal na yan? Kasi even the business community has been pushing for it, di ba?
Well, the first time we have recommended this to the IATF in the previous administration, hesitant po ang economic managers natin because we were just opening up the sectors during that time. Yung economy natin nagsa-start pa lang uli. So sinasabi nila baka maging hesitant, baka magkaroon pa ng delay sa pagbubukas, o di kaya bumagal yung pag-improve natin ng ating economy when we do that, because many are still non-boosted then hanggang sa ngayon naman. So yun ang sinasabi. So ngayon, ang atin namang proposal, at as kung sakasakali, hindi naman natin gagawin na bukas kapag naaprubahan ay mangyayari na. We will give time for the population to receive their booster shots, and then we will set a time when this definition would be applicable already to everybody.
Speaking of the private sector, I understand the COVAX facility will be replacing yung mga nag-expire na vaccines, including yung sinasabi nilang 5.1 billion worth. Can you give us more details about it?
Well, I cannot divulge any numbers as of this time, ma'am. No? So please try to understand that we are going to have some form of information meeting to our senators on Monday. So we are doing our inventories, and daily it changes. So we do not want that we preempt and give wrong information and ma-confuse ang public natin. What I can tell the public would be that we have had several meetings with the COVAX facility, and they have agreed and committed that they will replace all. They will replace all that have expired na vaccines dito sa atin. So even the private sector and the local government expired vaccines will be replaced.
That's well and good, but in the meantime po, do we expect that there is still a risk that might happen again? In other words, especially with people still hesitant to take on their boosters, is there a risk of us seeing vials and boosters and vaccines going to waste again?
Well, that is the goal would be for us to prevent this kind of incidents. So what we have done through our negotiations with COVAX was to have this schedule, no, of deliveries for these replacement doses. The schedule based also from the expiring dates that they would be providing to us as replacement would be scheduled when we already have near zero, no, yung parang sufficient na yung doses natin sa ngayon. We have requested that the schedule for deliveries will be towards the end of the year, so that these doses that had been replaced will be the ones that we will use moving forward from December to next year.
Kumusta yung uptake ng vaccines among the teenage population?
Oh, well, we have overachieved actually for the 12 to 17 years old. We have 109%. We have 9.7 million 12 to 17 years old who have already received 2 doses of the vaccine. What we are challenged with right now would be the 5 to 11 years old, because we only have 4.2 million, and it's about almost 40% only of the eligibles for 5 to 11 years old.
Bakit kaya? Ayaw ng parents?
Well, there's a lot of hesitancy among parents at this age group, no? Dahil alam naman po natin na syempre mga bata ito and they are so protective of their children. We just need to intensify our information dissemination to the parents that the vaccines are safe and it's going to protect their children, especially when they go back to school.
Now, ma'am, of course, OIC kayo ng Department of Health, pangkalahatang kalusugan natin. And as you started to pointed out, yung karamihan ng mga nagpupuno sa mga ospital natin yan are actually non-COVID. Maybe that's a good reason to remind our people about the other health issues that our people are confronting right now. What are the things that are top of mind for you that you feel you have to remind our people as well, other than COVID?
Yes, no. So we'd like to remind all of our citizens that it's not just COVID that we need to be aware of and we need to protect ourselves with. Meron pa ho rin tayong dengue situation ngayon sa ating bansa at dahil nga po tag-ulan, naandyan din po ang leptospirosis. Naandyan din po ang mga sakit ng mga kabataan katulad po ng tigdas na medyo meron ho tayong nakikita mga clustering of infections in the different areas of the country. And aside from that, syempre, we talk about chronic non-communicable diseases, sakit sa puso, stroke, iba't iba pa ho, no? Yung sa baga. Ito po lahat ay maaring mapigilan. Hindi naman po ito basta-basta na dumapo sa atin na wala tayong magagawa. If we can only have and comply with the preventive measures para gawin ito, makakatulong po tayo sa ating komunidad so that this kind of diseases will not continue to infect our population dito po sa ating bansa.
Speaking of...
Anong measure?
Speaking of preventable, non-communicable diseases, ma'am, I just want to ask your take on the vape law that lapsed into law, and a lot of anti-tobacco advocates and health advocates in general, of course, very concerned. But your take on this, ma'am?
Of course, we support ito pong vape na hindi po pumasa. So sinusuportahan po natin yung mga advocates natin dito, yung mga anti-vape. Tayo po ay patuloy na makikipag-posisyon at saka magpapaliwanag sa atin pong mga legislatura para po maintindihan din po nila kung ano po yung magiging impact nito sa ating mga kabataan. So we would continue to do other strategies aside from kung hindi pa naipasa kasi talaga, kung hindi pa natin talaga push talaga na mabago po itong batas na ito, we will continue on with our advocacy so that we can better protect our children from this kind of technologies and harmful products.
Okay.
Babalikan ko lang yung dengue. Usually nag-i-spike yan pag nag-i-school opening. Are you expecting the same trend? And what measures are you hoping for para mapigilan to?
Yes, ma'am. No? So actually, we are already peaking. No? Ang taas na ng mga kaso sa ibang lugar. We have 9 out of 17 of our regions na meron ho talagang lumakpas na sila dun sa threshold na tinatawag nating epidemic. Pero sa ngayon po, ang ginagawa natin, we have already mobilized our local governments, lalong-lalo na po yung LGUs ngayon, what they are doing before school opens. They are cleaning the surroundings, naghahakot ng mga kuyagot, yung kanilang environment, making it safe for children to go back. Ito pong pagtaas ng kaso sa ating bansa, may trend po yan. Nakikita natin na usually talaga mag-peak during the rainy season. And then pag natatapos na, bumababa. And then again, we'll peak again towards the end of the year. So hopefully we'll be all aware at saka magtulong-tulong, especially sa community, para to do the 4S strategy so that we can be able to remove and eliminate ito pong mga breeding grounds for the mosquitoes.
Merong debate on the usefulness of fogging. Ano bang stand ng DOH doon? Are they useful against? Talagang bang kailangan sila or we should do away with them?
Ang fogging po, kasama po yan sa 4S strategy. So ang sinasabi natin, we support fogging, yung rational use of fogging. Kasi yung iba po, ginagamit, hindi naman sila naglinis ng kanilang mga kapaligiran, basta fogging lang ng fogging. Ang nagagawa po ng fogging, pinapatay niya yung mga adult mosquitoes, yung mga lumilipad na po. Pero hindi naman niya mapapatay yung mga itlog na naandun, yung mga kiti-kiti na nakalutang pa rin doon sa mga pinag-iipunan ng tubig. So kailangan kung gagamitin natin yan, comprehensive po ang ating strategies. Gagawin natin lahat ng strategies to include fogging, but not just fogging because that will be irrational.
O, isa na lang, habol na lang kasi laging baha dito sa amin eh. Makukuha yung leptospirosis sa baha, di ba? It's possible.
Yes, ma'am, especially if the environment is very dirty, no? Kasi po umiihi ang mga hayop doon po sa ating tubig baha. At kapag kayo ay lumusong sa baha na meron kayong cut or sugat sa inyong paa o sa kung anumang na-expose na parte ng katawan, even tilamsik sa mata nyo, maaari nyo makuha ang leptospirosis. So the best way for us is to avoid wading in floods. Kung hindi naman po maiwasan, magbota po tayo at pagka-uwi natin sa bahay, immediately soap with rinse, no? And with soap at saka tubig po ang ating mga paa. At kapag tayo ay na-expose nga ng ganyan, meron po tayong gamot na iniinom para po tayo ay to prevent. We call that pre-exposure prophylaxis or post-exposure prophylaxis. Pupunta lang kayo sa ating health center. Libre po yan. Bibigyan nila kayo at i-instructan kung paano nyo iinumin yan.
Ma'am, sulitin na natin yung mga final reminders and very important reminders, not only because nabanggit nyo rin twice, pero maybe spell out for our people yung 4S na nabanggit nyo.
Yes, sir. No? So ang 4S po natin, ang unang-una is search and destroy the breeding grounds of mosquito. So atin pong linisin ang ating kapaligiran, especially yung mga kuyagot, pinag-iipunan po ng tubig, katulad ng paminggalan, yung inyong mga florera, the vase. Yun pong atin mga pinag-iipunan ng tubig dahil wala tayong tubig, takpan nyo po. Even dun po sa ating mga alulod, maari pong mag-ipon po at mabuhay dyan ang itlog ng lamok. Pangalawa, we also have this use of long sleeves at saka pantalon, no, para ensure natin na hindi nakakagat ng lamok ang ating mga anak and even tayo kasi it doesn't choose kung anong age nangyayari ang dengue. Kahit matatanda, nagkakaroon po. Pangatlo, we seek early consultation. This is very important. Kapag ka po nagkakaranas na ang inyong anak o kayo po ng lagnat na 2 days or more, magpapatingin na po tayo agad. Meron po tayong dengue test kits sa ating mga health center. Libre po yan, pre-procure ng DOH para sa ating citizens. You can go there so that you can be managed already. And the last one would be, we should support rational fogging, yung katulad po ng pinaliwanag ko kanina.
Okay, Undersecretary Maria Rosario Vergeire, OIC po ng DOH. Maraming salamat po.
Thank you, sir.
Thank you po.
And that's it for the Chiefs. We hope what was discussed will keep the conversation going. Ako po si Roby Alampay.
I'm Ami Pamintuan of the Philippine Star.
We are One News, all sides, all the time.